Hello, my name is Natalie Perez, and this is my executive summary presentation. Long-term care extends far beyond the care of the elderly. However, the elderly population does in fact make up the largest proportion of patients receiving long-term care services. With many varying services and deliveries of care, long-term care continues to develop and change. As our population continues to grow and age, the future of long-term care services will be heavily counted on to serve our communities. From infants being born with deficits, to adults suffering traumatic injuries, to the elderly no longer being able to care for themselves, long-term care has the potential to provide personal care assistance, healthcare services, as well as psychosocial and housing services over an extended period of time. Age is not a factor to this population, and life's circumstances can throw you into a loop that will require constant individualized care and support from caregivers. Needs of personal care, food and shelter, possible rehabilitation, and socialization opportunities are all potential services that could be provided to you. Since its inception, long-term care focused on the care of the infirmed, disabled, and elderly who lacked family or financial support. They began as private homes that were then converted to almshouses and infirmaries to treat and care for the impoverished and elderly. And during the years of the Great Depression, people who were at risk of losing their homes opened their doors by means of operating small private nursing homes in order to make ends meet. As time went on, the government became more involved and began to provide funding for those establishments. With varying facilities caring for different populations and needs, there are long-term care programs that will best fit the needs of all who require them. A skilled nursing facility that is Medicare and Medicaid certified is defined as a facility or distinct part of one primarily engaged in providing skilled nursing care and related services for people requiring medical or nursing care or rehabilitation services. Typically, the residents found in a skilled nursing facility are adults in their later years with cognitive impairments who used to live alone and have a decreased ability to function independently and lack a family who can care for them. The staff at these facilities include a physician medical director, nursing home administrator, director of nursing, licensed nursing staff, dietitians, housekeeping personnel, and maintenance workers. Services provided include physical therapy, occupational therapy, pharmacy, nutrition, recreational therapy, podiatry, dentistry, laboratory, and hospice. These facilities are highly regulated by state licensure and federal certification. An assisted living facility is one that provides long-term care to individuals whose needs lie more in the custodial and supportive realm. The residents typically require less assistance than the ones in a skilled nursing facility, typically being able to dress, feed, bathe, use the restroom, and move about unassisted. Yet there are staff available to assist with everyday tasks such as bathing, dressing, and medications. They provide supervision, simple housekeeping, transportation, and meals for the residents as well. In an ALF, the residents have some independence and are able to participate in activities in the home, providing them with a sense of community and family involvement, while allowing them to make their own choices in a safe environment. Many of these facilities contract with home health agencies to provide skilled nursing care and hospice care providers when such services are necessary. Home care is a community-based program provided to individuals in their own residences. This type of long-term care may be either a long-term provision of supportive care and services to chronically ill clients to avoid institutionalization, or short-term, intermittent care of clients after an episode of illness or hospitalization. This can be for a patient of any age. The care is provided with at-home visits by licensed nursing staff, home health aides, physical therapists, occupational therapists, speech-language pathologists, social workers, personal care aides, and homemakers, who are typically contracted privately. This type of program coordinates care for the terminally ill. Typically, when this type of long-term care is deemed necessary, It is for patients who have a terminal illness with a limited life expectancy of 6 months or less, and treatment is no longer a viable option. Palliative care is used in conjunction with hospice care, and it is provided to relieve the symptoms of disease rather than attempting to cure the disease. With its main goal to provide comfort to the patient, hospice care focuses on relieving pain, nausea, malaise, and emotional distress. Staffing these facilities include teams of nurses, social workers, counselors, physicians, and therapists. Drug therapies, medical appliances, and supplies, as well as bereavement services, are provided. Hospice care can be accommodated in the facilities previously mentioned. When a patient's primary caregivers are unavailable to be there, a temporary surrogate caregiver is provided to the patient. This is respite care. This form of long-term care is designed to provide planned and intermittent caregiver relief. Respite care is offered in various settings, whether it be at home, in a daycare setting, hospital, nursing home, or even group home. It is typically for short periods of time. Adult daycare centers provide a supervised program of social activities and custodial care, medical and rehabilitative care through skilled nursing, or specialized services for patients with Alzheimer's disease or other forms of dementia. Adult daycare centers are designed to prevent premature and inappropriate institutionalization of older adults by providing socialization and health care. These facilities offer medical, psychiatric, and nursing assessments, counseling, physical exercises, social services, crafts, and rehabilitation in day-to-day activities. Most of these institutions are licensed by the state. Much has changed since long-term care came about, and we have witnessed some grand innovations in this particular field of healthcare. Programs and services have been designed for the varieties of patients that require this form of care. Aging in place. As most people try to avoid the move to a nursing home or assisted living facility, the Aging in Place program became more prominent. These systems allow aging adults to maintain their independence while remaining in their homes to receive care, allowing them to live freely while still receiving necessary support and care. Continuing care retirement and life care communities. For those who are well enough to live on their own but would rather not, continuing care retirement communities exist and are available to provide retirement complexes equipped with social services, meals, and access to contractual medical services. Naturally occurring retirement communities. Apartment complexes, neighborhoods, or community sections where most residents are age 60 and older are what you would call a naturally occurring retirement community. NORCs use services to improve the lives of those who live in these communities. Things like nursing, social and recreational activities, health education, transportation, and nutrition are all part of the services provided. High technology home care. Hospitals without walls. Some patients who require long-term care have a need for highly technological services such as ventilators, dialysis, IV antibiotics, and chemotherapy. Rather than being hospitalized or institutionalized in a facility, high-technology home care allows patients the freedom to have these technologies delivered to them, allowing the patient to feel more freedom in their own home. Long-term care insurance, having originally been offered in the 1960s and covering only nursing home care, is one of the financing options used for multiple long-term care services. A 2016 report stated that the LTCI now covered long-term care in the varying facilities. The federal government has encouraged the purchasing of long-term care policies by offering tax deductions to employers who offer this type of insurance as a benefit. As time goes on, the U.S. will have a need for more diverse long-term care programs in order to better serve the aging population. It seems as though we will be moving toward a long-term care system that is community-based, which allows flexibility, consumer choice, and care coordination, as opposed to being in a hospital or institutional setting that is far more rigid and costly. Experimentation and innovation are sure to continue in the coming years in order to provide our long-term care patients with the best quality of life they can attain. Thank you so much for listening. Have a great day.